my name's Danny. I'm going to be your student nurse for today. And if I could just see, I'm going to do hand hygiene. If I could just see your wrist real quick. Okay, perfect. And then could you just confirm your full name and date of birth, please?
Andres Rogoso. I was born February 8, 2003.
Okay, perfect. And then Andres, do you have any allergies?
Not that I know of.
Okay, perfect. And can you tell me where you are today?
Hospital.
All right. And then do you know today's date?
I think today is January 14th, 2021.
Okay. And then do you know who the next president is going to be?
Joe Biden.
Okay. And so your orientation is ×4. It's a good sign. Vital signs is next. Vital signs were actually done by a CNA prior, and the CNA came back with good results. Your blood pressure is at 120/80. Your respiratory rate is at 14. Oxygen level is at 99. And your temperature is at 98.7. All good findings, okay? And so just looking at my patient, I could tell that he's in a good mood. So you're normally in a good mood like this?
Yeah, for the most part.
For the most part, perfect, okay. And then are you in any pain on those?
No.
No? Okay. So what I like to do now is a head to toe assessment. It'll probably take me a couple minutes, okay? So I'm gonna start off with your hair. So with your hair, I'm just gonna be looking for any lice, any lesions, any bumps. And no, everything is good. Okay. So now I'm gonna be moving into your ear. And so when checking in your ear, I'm gonna be checking for, let's see, any redness, any swelling lesions, or any drainage. And no, and then, okay, we're checking this here as well. Perfect, okay. So now I'm gonna be checking your nose, both nostrils. Both nostrils are nice, pink, moist. There's no redness or any drainage coming out. Perfect. And then with your mouth, could you just say ah for me real quick? Ah. Okay. And now I'm checking the same thing, any lesions, any redness, none is present. Mouth looks nice and healthy. Perfect. You can close that now. And then I'm gonna be checking your neck, okay? So just visually looking at my patient right now, his trachea is midline. It's a good finding. I'm gonna be checking for the thyroids as well if they're inflamed, and they're not. Good finding. And there's no signs of JVD. So now next I'm gonna be checking for your lymph nodes, okay? All right. Okay, so I'm gonna start off with occipital, then posterior articular, and then I'm gonna be checking for pre-articular. Okay, and I'm taking the carotid. Okay, tonsillar, submandibular, and then submental right here on your chin. Okay. Superficial, right here down on the neck. And then deep cervical. And then posterior cervical. And then the last one's going to be supraclavicular. Okay, perfect. All your lymph nodes are nice and healthy. I can tell that none of them are inflamed, which is a good sign, alright? And like I said before, there's no signs of JVD present. So what I'd like to do next is I'd like you to close your eyes. Cover one nostril. I'm just going to put something and you just tell me what you smell, okay?
I think that's coffee.
Okay, coffee.
And then
yeah, just tell me what you smell.
yeah, it's like a type of candle.
Like a candle, okay? And then for the carotid, what I like to do is actually check for any bruits, okay? So I'm going to check each side. And then there's no bruit present. So next I'm going to be checking, I'm going to palpate them, okay? And I'm not going to do them at the same time because that's dangerous. So I'm going to do one with a nice strong pulse. And then the same thing, we just check if it's the same. And it is. Perfect, okay? Alright, so next I'm going to be doing the vision exam. The vision exam was actually done by the CNA prior. And the CNA reported that you have 20/20 vision, which is perfect, okay? So next I'm going to be looking for perla. So looking at your eyes right now, they're at a 3. They're round, right? I'm gonna shine a light, just keep looking, okay? They react to light, perfect, and they accommodate well. So let me see. Just look at my nose and just follow with the pen, okay? With your eyes. Perfect, okay. All right, so perla is present. And so now I'm gonna be checking the 6 cardinal fields of gaze, okay? So with this pen, I just want you to follow where it goes, but keep your head straight. 3, 4, 5, 6, and then check the middle again. Okay, perfect. Now I'm going to be doing the facial nerves. And for facial nerves, if I could just have you puff up your cheeks, okay, and then let go. And then if you could just raise your eyebrows and then give me a frown. Okay, perfect. Next, I'm gonna be doing, let's see, the whisper test. Okay, or actually, with the facial, when I touch you on your face, just tell me now when you feel it. Okay, just close your eyes.
No. No. No.
Okay.
No. No. No.
Okay, perfect. Now I'm gonna be doing the whisper test. Okay, so I'm just gonna be whispering on each ear, and you just tell me what you hear. 1, 2, 3.
1, 2, 3.
Okay.
ABC.
Okay, perfect. Next is gonna be the wrong verb test. If you could just stand up for me, and if you could just put your hands out like this, and just close your eyes, and just hold it for 30 to a full minute. Okay, perfect. And you can just sit down 30 seconds later. Alright, perfect. And then next I'm gonna be checking for your gag reflex with a tongue blade. If you could just take your tongue out real quick. And then just checking, so I'm gonna be yink, right? And you gag, whatever. And then tongue movement, if I could have you stick out your tongue. If you could just lift it up, down, to the side, side. Okay, and then next I'm gonna be doing the trap muscles. If you could just shrug your shoulders real quick. Like that, perfect, okay. Next I'm gonna be assessing your balance, okay? So if you could just stand up one more time. Arms wide like this, and just try to resist keeping your balance, okay? Perfect, alright. Since I have you up, if you could just do the heel to shin, right here. Or actually, heel to shin, right? Like this.
Like this?
Yeah.
Alright.
And then the other leg. Perfect. Alright, and then I'm going to do the rapid movements. So if you could just sit down again. With your arms, just do this real quick. As fast as you can. As fast as you can. Perfect, okay. So now I'm going to move into the chest and arms, okay?
Mm-hmm.
I'm checking for skin integrity. Just looking for the same color. There's no redness, no swelling, no inflammation. I'm going to be checking turgor. Making sure your skin goes back. It's a good sign that you're well hydrated, okay? I'm gonna check for warmth on your arms, right? They're warm to the touch, nothing's cold, which is a good sign they have good blood flow. There's no edema present that I could see, any scars or lesions, I don't see any. Checking for the thoracic cage for symmetry, and yeah, everything's symmetrical. Muscle development is normal for your age and configuration is perfect. Alright, so next I'll be checking and palpating the symmetry of your expansion, right? So if you could just take a deep breath in and out. Okay, everything's symmetrical. There's no labored breathing in the patient. So what I'd like to do next is actually assess your brachial pulses and your radial. If I could just have this arm checking brachial, radial. Alright, and then this one, and then this one. Perfect, and everything's symmetric, everything's flowing perfectly. Alright, so I'm gonna be checking for your range of motion, alright? So if you could just do this real quick. Alright, move them like that, and then down and up. Perfect, range of motion is perfect. And then with your hands, if you could actually, let's see. If you could give me your hands like this. Alright, if you can push towards me. Okay, and then resist. Okay, perfect. Your strength is perfect. Next, I'm gonna be checking your reflexes on your arms, alright? So if you just give me one arm real quick, I'm gonna be checking this one right here, and then this, just give me a dead weight. Perfect. I'm gonna be doing this one as well. Perfect. 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 Okay, and I'm gonna be checking for your capillary refills. If I could just have your fingertips on each one. All I'm looking for is that whiteness to go away before 3 seconds, okay?
Mm-hmm.
And do you see how all of them are going away?
Yeah.
It's a good sign, alright? So your capillary refill is below 3, all bilaterally, which is a good sign. Next, I'm going to go into the heart and lung sounds, alright?
Okay.
So I'm just going to be listening to your heart rate. I'm checking the aortic valve, right? The aortic valve is the second intercostal space in the right sternal border. S2 is greater than S1, right? I'm checking the pulmonic valve, second intercostal space, left sternal border, S2 is still greater than S1. Checking into the third, which is Erb's point. Let's see, it's the third intercostal space, left sternal border, S1 is equal to S2. Fourth intercostal space, tricuspid, right? And then the left sternal border, S1 is greater than S2. Okay, moving down just a little bit more, I'm going to go into the mitral valve, and it's the fifth intercostal space, left midclavicular line, S1 is greater than S2, And then finally, I'm going to be checking your typical heart rate for a full minute, right? Just lean forward a little bit. Okay. Perfect. Your heart rate's at 70, which is perfect, okay? Alright, so next I'm going to be checking your lung sounds. I'm going to be checking the front, moving the weights to the sides and then the back.
Alright.
So from the front, just give me a deep breath in and out. Okay. Deep breath in and out. Yep. Deep breath in and out. Perfect. Laterally, if you could just move your hand real quick. Okay. Here. Alright. And posterior should be 10 spots. Moving way down in a snake-like pattern. Making sure it's not on bone. Cool. While I'm listening to your lung sounds, I can tell that you are not labored in breathing, right? There's no crackles, which is a good sign. So now I'm just gonna ask you to lay down real quick. I'll just move this out the way. Let's say this. Can you tell me when your last bowel movement was?
Pretty sure it was yesterday.
Okay. Yesterday. And then, was it abnormal?
No,
No? Everything normal? And then when's the last time you peed?
I think this morning.
Okay. And then can you describe the color to me?
Mostly clear.
Okay. Clear. Alright. And then let's see. And it doesn't burn when you pee?
No.
Which would be sign like of STI, which is good. Alright. So next I'm gonna be inspecting your stomach, right? So lift up your shirt. And then I'm just looking for any hernias, any redness, any discoloration on your skin, any scars that are present. I just see right here. Let's see. Okay. Perfect. And I'm gonna be checking the 4 quadrants, alright? So while I'm checking the 4 quadrants, I'm just looking for any bruits. No bruits present, and all 4 quadrants are active, which is a really good sign. Alright. And so let's see. Next, I'm going to be moving down into your legs, and I'm going to be checking your skin color and any signs of lesions, any bumps, abnormalities present, any signs of edema, right? And I can see everything's perfect. Okay, so now I'm going to be testing your range of motion. So if I could have this leg raise up, okay, to the side, and then down again. Perfect. And then if I could do it on that leg as well, raise it up, to the side, down. Range of motion is perfect. Now I'm going to be checking for your strength, alright? So with your toes, if you could just press against my hands. Good. And then resist and pull back. Okay, perfect. Strength is nice and well. Next, I'm going to be checking, since I have you laying down actually, I'm going to be checking your PDO pulses at the same time, making sure they're symmetric and I can hear them. Perfect. And then your tibial at the same time. Perfect. And I'm going to do your plantar reflex, alright? So if I can just have you sit down again. Perfect. And I'm just going to bump over real quick. 1. And this one. Perfect. Alright? And this. So the call light's going to be right here, within reach, right? Is there any other questions you have for me?
No, that should be it.
Okay. And then actually before I go, I just want to check your capillary refills on your toes. If I could just have you lay down. Almost forgot that one. So we'll be checking each toe. Each toe is less than 3 seconds, just like how I did to your fingertips, which is a really good sign. Everything's nice and healthy. So just stay right here. The doctor should be in a couple minutes. And you said you were fine, right?
Yeah.
Okay. So yeah, don't hesitate to press the call out if you have any questions, right?
Okay, thank you.
Thank you.